When you wanted to choose IELTS or OET, what would be your choice? Being a healthcare professional, even you are a nurse or a doctor, always you have a confusion whether I have to choose for IELTS or OET to go to UK or Ireland or any other countries. Hey guys, welcome to Nursing Empire channel and myself I'm Pratisha Chowdhury, who is a passionate nurse educator who wants to help millions of nurses around the world in learning and development which can help them to achieve their dream jobs. If you haven't subscribed to my channel, please do subscribe. And in case if you find this video to be informative and it can help or benefit some of your family, colleagues, or your friends, then please do share. And if you like this video, please do like. When you're confused in either selecting the option whether I have to go for IELTS or for the OET, so this is for you. And here the question comes is, which is the best option for me? Yeah, let me run you through this so that you will understand whether which is important for you. So what is OET or IELTS? Which is good or which is easier? See, there is no big difference between IELTS and OET because all four modules are similar. Like in the OET and IELTS, we do have the four modules: the first, listening, reading, writing, and speaking. These four modules will decide what is your proficiency either in the English language. But there's a big difference between IELTS and OET. One is IELTS is either we can go for general or academic, or in the OET, it's just only for the healthcare professionals, which will benefit the healthcare professionals specially. What OET does? OET is specially trying to check the ability whether you can communicate in English only when you are there in a healthcare setting. So this is what it is trying to set you. Like in case if a patient comes to a hospital in UK or Ireland or in European countries, so how would you talk to them or how would you communicate with them about their own condition? It's just like a healthcare environment. Either you are trying to describe about a patient's condition or either you wanted to communicate about a procedure to the patient, whatever it may be. So it tries to just check your knowledge based on all these four modules with only your healthcare setting. Whereas your IELTS is just trying to check your overall ability to communicate in the English language. So here it's a broad difference that we have between the OET and IELTS. So because IELTS is trying to check only your English proficiency and it's a broader way. And you can't say that like it's easy, because those who are fluent and those who have a good grammatical IELTS always test your English language, and totally this depends upon your grammatical and also if you are fluent enough in understanding the vocabulary which has been given in the examination, or whether you can able to predict different accents that are being used in the listening. So these are the things which you will be doing in IELTS. What are the similarities that you can find between the OET and IELTS? So the main thing, as I said you before, it would be listening, reading, writing, and speaking. These are the four modules that you have to crack either in OET or the IELTS. So the other important thing is what would be our scoring either in the IELTS or in the OET. So in the IELTS, you have 9 band and you have to score 7 in case if you wanted to get eligibility to go either to the European countries, and it differ according to the country to country. In case if you wanted to get OET, so the score band would be B and it ranges from A to E. In this band you have to at least get the score of B to get the eligibility. So this is about the similarities. Coming to the top 4 priorities in each test Either it may be IELTS or OET. So let's see what are the main four priorities that would be differing from one to another. So coming to content, in the content you will be getting in IELTS would be general and academic vocabulary. And whereas in case if you are going with the OET, you are going to either it may be a medical professional or a nursing professional or a completely on the patient case scenarios or the healthcare background or healthcare setting. Coming to the varieties, what are the different varieties that you will be seeing? So the varieties are like you would be it's like two varieties that you can see in the IELTS, and that is general and academic. Two varieties will be there. General would be mostly for the PR, and academic will be for those who wanted to study in abroad, and also for those who are wanted to work as a nurse or a doctor. In case if you wanted to talk about the varieties in OET, so OET also have different, like 12 different healthcare professionals, where anybody of these healthcare professionals wanted to settle down or to work in abroad, like in the European countries, they have to definitely get a band B or a grade B in the OET. Coming to the gradings, as I was talking about the gradings, so the gradings in IELTS would be scored from 1 band to 9 band. So you have to at least score 7 band in all of the 4 modules. And it would also differ with country to country. Coming to the grading in OET, it will be grade from A to E. And to get eligibility, you have to definitely get a B band or a B grade. Coming to the recognition, who will recognize and where it will be getting recognized? Recognition is just nothing but which country would make you to get eligibility either for IELTS or OET. Coming to IELTS, IELTS is accepted worldwide. So there is no big difference in that. But OET is just accepted only in few European countries, whereas not in all of the countries and not for all of the studies. That's the only drawback. The pros and cons of IELTS. Let me get you through what are the pros and cons of IELTS and also with the OET. So the first pro is cost preparation of the exam is completely lower. So if you compare what is the cost of preparation like, it's very low. And also in case if you wanted to get material to study for IELTS for all these 4 modules, it's quite easy. Everywhere in the internet and everywhere in the YouTube, you get n number of material. What is the main con? Because the passing rate is very less. To get a 6 and 6.5 is damn easy, but still to get a 7 in all is little difficult for the healthcare professionals, especially because they would not be coming from the good academic vocabulary which will be used in the technology. But still, though this is not so impossible, we can do this. But the passing rate compared for the healthcare professionals since from a long time, since from these 2 years, the passing rate is very less, and people are going from many attempts, and after that they were trying to get a band 7. So rather than that, this is the only main thing that we can say it as a con. And the fee structure, the fees, how much we have to pay for IELTS examination in the Indian rupees, like you have to pay just 13,250. So this is the only test which we are going to pay very less for the IELTS examination. Maybe it's a higher number, but still compared with OET, I'm trying to say that this is less. So let me walk you through OET pros and cons too. So coming to OET pros and cons, in case if we see it's an exam which is just based on our healthcare working environment, where it would be completely about the patient scenarios, and we doesn't need to work much on like the academic vocabulary which is being used in the IELTS. What is another pro that most people will be definitely getting benefited with OET, because the passing rate is highly good. Only thing is they have to just get a grade of B. And one more thing is, this would be definitely possible in case if you prepare well in the first attempt. So Please be cautious. Don't be overconfident in the first attempt itself and you say that, yeah, I know everything, because just it is a patient care environment. Please do not be mistaken about that, because you need to have a good preparation. It also tests your technical knowledge on the vocabulary and also how far you're able to understand with the listening of audio with different accents of the patients and the healthcare professionals' communication. Whereas in the reading, it will also test you how far and within a given period of time or within a limited period of time, how were you able to analyze the answers and try to interpret with the given extracts. In case if it is about the writing, it's just a very small letter that you are supposed to write, but still analyzing that, interpreting the case note and how you're going to write it would be a difficult task in case if you are not well known about the structure, and also grammatically if you're weak, you have to work on those parts. And coming to the speaking, there are different criterias and the different bands which will be given according to the criteria. You have to understand those criterias, which I will be making in the next videos, so you will better understand about how you have to be prepared about the IELTS or for the OET. Coming to this, for every IELTS, means for every one person will be passing the IELTS compared with the 5 people, those who passes in the same time for the OET. So this is the best thing that I said, like OET is a very good option for the healthcare professionals. Coming to the fees, when you go for the cost of examination, this is the biggest thing that everybody says, oh my God, is this so much? Yup. Yes, that's so much. Actually, compared with the IELTS, the OET examination fee is 587 AUD, because in the Indian costing you 33,090 rupees, and it also fluctuates according to the dollar cost. Whereas only one thing I can tell you as a benefiting one, because in case if you are well prepared with the OET, and there is no chance that you're going for the second or for the third attempts, because the structure need to be understood for either of the examinations, either it may be IELTS or the OET. But the main thing is IELTS, in case if you're not good at the academic vocabulary, please don't go for that. Please try to go only for the OET. That would definitely benefit you. Don't see at the cost of the examination, because the examination would be only given for one. But whereas the passing rate for the IELTS, you will be spending 10 times more than what you have spent in the OET only for the first attempt. So please do check out for the OET. The bonus tip is, like, in case if you wanted to go for Ireland or UK, there is an option that you can combine your IELTS score or the OET score. But how would we do that? So the main thing is you have to always do this in the 2 attempts, but it should not go within more than 6 months of gap between your first examination and your second examination. For example, if you have taken your examination of OET or IELTS in the month of January, then you have to take your next second attempt between means the next May or June, before June. So that would be counted as a 6 months period of gap. But what you have to test again, it would be testing you either. Always there is a question whether I have to go for all the examinations. Yes, you have to attempt all of your examinations completely. So that means all the 4 modules you have to write. In case if you have got only C or C plus in your writing, then also you are supposed to write all of these 4 modules. But the question is, you have to score at least 6.5 in all of this. Means in OET you have to get at least C plus in all of these 4 modules, and rest which you have missed, that you have to get definitely the B. And all scores, as I said, the all scores should have 6.5 in IELTS, and you have to score 7 in which band you have missed. And then if in the writing section or in the reading section, any of this, the same thing will be applicable, and 6.5 is equal to C plus in the OET. So you have to get C plus in the OET and 6.5 in IELTS. And later, here is an example that I wanted to show you for the required scores for UK or Ireland. So recently there have a different changes that has come up with the Ireland and OET. In the first one which I'm showing you is IELTS scores, and the second table which I'm trying to show you is for the OET. So in this, the four modules have been kept. In the listening, you have to score at least 7, and then reading 7, and writing 6.5, and speaking 7. So overall band you have to get definitely 7. Yes, you have to get it. And in case if you wanted to score the same in OET, then you have to get all B. And in writing, you have an exception that you can get C+, the same as in this here is 6.5. And so these are the new guidelines which has been kept in the NMC for the English requirements. Yes. So this is about it. In case still if you have any queries, please drop that in the comment section about whether you wanted to go for the OET or for the IELTS. Definitely I would be helping you in clearing those doubts. Any kind of doubts, you can just drop down in the comment section. And one more thing is, still you're confused, what would be my suggestion for you is, if you're a healthcare professional, please do go and sit down for the OET and do that. And the good preparation always make you to be the best one. So please do go for OET. In case if you want some help, please drop down in the comment section. Thank you all. Please do subscribe.